Hello, and welcome back to another Lunch and Learn, or welcome if you are new around here. I am Dr. Jen Dickinson. I am the owner and founder of Mid-Missouri Pelvic Health, a pelvic floor physical therapy clinic located here in Sedalia, Missouri. So today's Lunch and Learn topic is a little more on the serious side, but I'm going to go over kind of why and then how to talk to your kids about their own body parts, specifically the external genitalia. As somebody whose job frequently entails having conversations with patients related to experiences where not great things happen to that part of their body in the form of abuse and that sort of thing, it's very important to start teaching them from a young age kind of what an okay touch and a not okay touch is, and that's to start giving them some power. I frequently will recommend that you start having this conversation when they are really little, like in bath time. So you don't necessarily want to wait to have this conversation lumped in with the birds and the bees or around the time that they would potentially, start going through puberty. Like that's way, way too late. So when kiddos are little, I'm talking 1-2 years old, during bath time is when it can be super helpful to start going over the actual anatomical terms for what their body parts are. So for a female, that would be the vulva on the outside, and then for them to know when they're a little bit older that the vagina actually is on the inside. And then for a male, that would obviously be like the penis and then the scrotum. And so you can kind of talk to them about anything that is hidden by a bathing suit would be considered a private area. And so anything that would be covered up by underwear or a bathing suit is really not for anybody beyond themselves, their parents, when they're helping, clean them up and changing diapers, and when they're a little bit older, wiping your bottom and that sort of thing. And then really at the doctor's office when they're just checking things to make sure that developmentally everything is going okay. But anything outside of themselves, their parents, or the doctor, really nobody should be touching anything down there. So that would be a not okay touch, as opposed to like a hug. If they are open to having hugs, that would be an okay touch. So, why is it important to give them language around the actual anatomical terms for their body parts? Well, there's a couple of reasons. One, the younger you start, the less awkward it is. So if you're trying to course correct and give them an anatomical term when they're 16, it's a very different conversation than a young child just growing up knowing that that's what their body parts are called. But it's also important for them to know how to describe any pain that they're having down there. So I'm having pain in my penis when I pee is very different from, my nuts hurt. So it gives it a little more specificity in order to help have that conversation with the doctor. But kind of on a more serious note, it helps them be taken much more seriously it helps them be taken much more seriously if a not okay touch were to take place. So a lot of times if kiddos are going to share that information, it's going to be with a trusted adult. And if a 6-year-old goes to their kindergarten teacher and says, "Hey, so-and-so touched my cookie," that's a very different response to, "Hey, so-and-so touched my vulva." They just get taken very seriously right away, and they're much less likely to be dismissed, which can be super, super important. So the other reason it's important to start having these conversations is because you want to set the scene for self-exploration, to not have a shame component to it. I see people in their 20s, 30s, 40s, 50s who have a lifelong history of shame related to anything sexuality related. And a lot of times it can be kind of counterbalanced by just starting to have those conversations in adolescence and in childhood. So kids are naturally going to explore things with their bodies. I mean, if you've ever seen a toddler, they stick literally everything in their mouth. Well, that's how they learn and that's how they explore. And so they're also naturally going to do that with touching different parts of their body. And it's important to not shame them or, hit their hand away or yell at them, because then they start to get this very deep connection that anything with that part of my body is bad. And we don't want them to think that it's bad. They just need to learn the ground rules behind that. So it's important to help teach them that, oh, I see that you're, watching TV and you've stuck your hand down your pants, and hey, it's okay to kind of explore and see what feels good and what doesn't feel good. Like, it doesn't feel good when I pull my hair, but it might feel good if your hands are down your pants. But that's not something that we do in the living room. Like, that's something that you do in private, and that's something that you do by yourself. If somebody else is trying to touch those body parts, that's a not okay touch. And so it really, again, just kind of gives them language and helps to not have them associate that part of their body with shame or being bad, because those sorts of kind of self-talk really linger into adulthood. And if we can even just have, a couple of conversations with when they're little, to help combat that and help them lead a normal, healthy, existence when they're older, then all the more reason to do that. All right. This one was a little bit heavier, but please, please, please talk to your kiddos, because they will associate the first person they hear this information from to be the expert, and you don't want it to be on the playground, because goodness knows they have no idea what they're talking about. All right. I hope you have a great week, and I'll see you next time. Bye.